Welcome everyone to Dental CE Academy. I'm Dr. Kirsten Rolling. I'm the Chief Education Officer here. We have an exciting presentation for you this evening. Nano Hydroxyapatite Unmasked, Debunking the Myths and Harnessing Science for Improved Oral Health. Before we start, it's very important that you have the information you need to be successful this evening and get your CE credit. In the chat area is a purple box. If you tap on that link, that will download the handouts for you and the CE credit instructions, or cut and paste that in your browser. We're going to give you 1 minute to do that, and we're going to bring up the presentation here. These have also been emailed to everyone about an hour ago, so it's also sitting in your inbox unless you registered since then. Again, please go to that purple box in the chat area and download the handouts for us and the CE credit instructions. I'll review those with you. All right. So how do you get your CE credit this evening? This course is 1 hour. And at the end of that 1 hour, you are going to be invited to stay on and learn from our sponsor, Dr. Jen Natural Oral Care Products this evening. That is not required for CE credit, but I know you'll want to stay on because you're going to have many questions. This is exciting information. It is evidence-based. You'll see all the citations in the back of your presentation. So again, please stay on to learn more. At the end of the 1 hour, you can log out and be redirected to the quiz. Quiz will also be emailed to you at the end of our full presentation, which is 6:30 p.m. Again, you are not required to stay on for the promotional webinar, but we do hope that you will. So with that, I am going to go ahead and introduce you to our speakers this evening, Dr. Jennifer Eisenhuth and Peter Eisenhuth. For Dr. Eisenhuth, after studying engineer at the University of Minnesota, she attended the University of Minnesota Dental School, obtaining her DDS in 1994 and her master's in orthodontics in 1996. And over the last 25 years, she has run a private practice and been a part-time faculty at the University of Minnesota Dental School. In addition to private practice and teaching, she is, along with her husband, Peter, committed to creating healthier and more effective preventive oral care products. And Peter Eisenhuth, over the last 25 years, has dedicated his career working in the dental care industry, helping doctors advance their level of oral care. Working alongside his wife, Dr. Jennifer Eisenhuth, he has spent the last 5 years researching and developing clean ingredient preventive oral care products using modern and advanced materials, in addition to his constant pursuit to improve and develop modern preventive oral care products. Peter works closely with dentists and hygienists throughout the country, providing instruction and education on the use of modern preventive oral products. So folks, you have two leading experts here in nano hydroxyapatite, researchers and educators all over the US. So be sure to type your questions in the chat area. We'll address those at the end here, and I'm going to turn it over to both of you. Welcome.
Thank you so much, Dr. Rolling. We really appreciate this opportunity. I'm Jennifer Eisenhuth. I'm just going to run right actually through all of this stuff. There's me. There's my husband, Peter. He's sitting right next to me. Dr. Rolling kind of gave our bios a bit. And the biggest question, the first question that we always get is, how did we end up in toothpaste? And this photo, this ad actually goes back to when I was a brand new graduate. This was the very first ad. I started my own practice. This was the very first ad that we had run. It was well before we could afford anything online. And so it was just in this little local newspaper. But the reason that we entered toothpaste is actually the daughter that I'm carrying, that I'm holding in this photo. That is our daughter, Claudia. Claudia and the rest of our family eventually grew, and she entered college, eventually was accepted into dental school. And while she was still in college, she contacted us while she was in the middle of some tests, and she said, I can't sleep. My jaw hurts. It's keeping me awake. I can't study. I can't concentrate. And so we thought, okay, there's got to be something going on. Now, she was going to school, going to college in northern Minnesota. It wasn't easy to find somebody that could see her after hours, but we did find a dentist that was willing to see her as a favor. And she went in, and the dentist thought, okay, you know, there must be something that is fractured, something that she couldn't diagnose. And so she gave her some antibiotics and sent her to an endodontist to be evaluated. Now, an endodontist in a small town in northern Minnesota, also not easy to find. It took a while to get on a schedule. She was given more antibiotics, and they couldn't figure out what was really wrong. And after about 5 weeks of antibiotics, she ended up contracting what is called C. diff. It was a pretty serious case of it. She was in and out of the ER several times and eventually admitted into the Mayo Clinic in Rochester, Minnesota. She was one of the youngest patients that they needed to admit. Normally, a 22, 23-year-old can get on top of this fairly easily, but she could not. Hers was so strong. And so once she was admitted, the physicians at the Mayo really explained to her and to us that she needed to treat her gut, which had been really wiped out. The biome was gone. She needed to treat her gut as though she were an infant. And so she needed, like an infant, she needed to watch the foods that she introduced, and she needed to watch any of the products that she used. And so we changed, you know, our laundry soap, regular soap, shampoos. And I really thought, being in the dental world, we should be able to find a clean ingredient remineralizing toothpaste without much of a problem. But unfortunately, we weren't correct with that. This is Claudia when she was in the Mayo Clinic, smiling. She's always smiling, even though she was pretty darn sick at this point. And so what we did was look everywhere for a clean ingredient toothpaste that would remineralize enamel. And our home turned into like an Amazon kingdom of boxes. We had so many different types of toothpaste. We tried everything we could find. We went to obscure websites and ordered. And really looking at the ingredients in all of these toothpastes, we couldn't find anything that followed the science, and we couldn't find clean ingredients. Now, when you look at, you know, toothpaste ingredients, you know, when we were in dental school, we're taught, okay, you know, make sure there's fluoride, make sure there's fluoride. But really, at least at my dental school, I didn't learn much beyond make sure there's fluoride in the toothpaste. But when you dive deep and look into just traditional toothpaste, there's some stuff in there that you really don't want. We swallow about 5 to 7% of the toothpaste that we use. And if we're young kids, they swallow up to 25% of toothpaste that they use. And so really want to look at the ingredients and make sure that what they're swallowing and what we are swallowing is okay. Most toothpaste contain PEG, which is a form of petroleum, kind of like antifreeze, essentially. Many toothpaste can contain sodium lauryl sulfate, which we know is an endocrine disruptor. And then synthetic coloring, synthetic flavoring, all of that stuff is tough on our gut. And so we ended up just saying, you know what, if we can't find, you know, a toothpaste that has the clean ingredients that we want, that will remineralize the enamel, that will follow the science, we might just have to create one ourselves. And it started as kind of just a little, you know, something we talked about at dinner and grew into something else. The toothpaste formulations have really not changed a whole lot since the 1960s. And if you think about dentistry as a whole, think about how much everything else has changed. We used to take impressions, and now we can do scans. We used to do, you know, x-rays with the little developers, and now, you know, we don't have to do that. We've got the digital stuff. And why didn't our toothpaste change? Some of the chemicals that are in current toothpaste, they've been banned from food, and yet they're in our toothpaste. So we're going to go through a few myths in our presentation today. Myth number 1, all toothpaste sold in the United States is regulated by the Food and Drug Administration. And that is definitely a myth. If there is fluoride in the paste, then the FDA is involved and they are overseeing it. But once fluoride is removed from paste, the FDA turns a blind eye. They are no longer regulating that paste. And so that means that many clean ingredient or natural toothpaste, they can put in whatever they want to put in, and they can say whatever they want to say, and no one is regulating that. So in general, we kind of consider fluoride-free products the Wild West of the oral care, meaning these brands can really put in whatever they want and they can say whatever they want. Nobody's stopping them. I'm going to let my husband Peter take over.
All right. Well, thanks, Dr. Jen. Hey, thank you everybody for joining us. Dr. Rowling was telling us we were in competition with some basketball, so thanks for choosing nano hydroxyapatite over basketball. But we'll make it worth your while when we're done with this presentation. All of you will be experts in nano hydroxyapatite. You're going to learn fairly quickly that there is quite a bit of science behind nano hydroxyapatite. And even though this might be fairly new to you or your office, it's actually been around for a long time. So we're excited to share our knowledge. We've been working with nano hydroxyapatite for the last 5 years. When we started working on finding a nano hydroxyapatite formulator, we actually had to contract with a chemist out of Germany because there wasn't any chemist in the US that had any depth of experience working with nano hydroxyapatite. And so we feel very fortunate we can share what we've learned over the last 5 years. So I'm going to touch on a few things. We'll just do a little basic review of Dentistry 101. Number one, why do our patients need a clinically proven remineralizing ingredient? Well, the main culprit for most of our patients, it's bacteria, acid-causing bacteria like Streptococcus mutans. When our patients consume this lovely Western American diet, carbs and sugars, we know that bad bacteria, acid-causing bacteria, becomes very productive, creating acids in our patient's mouth. Well, as strong as our enamel is, it's not resilient to acid. In fact, the critical pH of enamel is 5.5. And so when acid is being created, what happens is the pH levels drop in our patient's mouths. Once it gets to 5.5, demineralizing occurs. Phosphate and calcium ions start to leave the enamel surfaces. Now, our body can heal itself, and this is even true with our enamel. We have this wonderful fountain of youth called saliva. And, theoretically, saliva can offset phosphate and calcium deficits. Number one, saliva has bicarbonate in it. So after we're done eating, it takes about 30 to 40 minutes for your patient's pH levels to come back up to neutral. After that, phosphate and calcium ions will enter back into the enamel from our saliva. Unfortunately, though, because of the Western diet and loads of bacteria that cause acid, saliva generally isn't enough for a majority of our patients. Around 90% of our population, at the end of the day, end up with phosphate and calcium deficits. And we know that if our patients have phosphate and calcium deficits in the enamel, I'll go back to this slide, we know caries will develop. And so what can we do as dental professionals? We can make a recommendation for our patients to use a toothpaste containing a clinically proven remineralizing ingredient to offset phosphate and calcium. So what are clinically proven remineralizing ingredients? Fluoride. Fluoride is one. I'm going to touch on fluoride. I'll talk about the biochemistry of fluoride. Then we're going to get into nano hydroxyapatite. As you're going to learn, they do function differently. And as you'll see later, there can be a synergistic benefit if we combine the two. But quick recap of fluoride. You remember this from dental school or from your hygiene programs. What does fluoride do? It creates fluoroapatite. How does it create fluoroapatite? Well, we know 97% of our enamel is hydroxyapatite. What happens is when fluoride is introduced, whether they get a fluoride treatment or they brush with fluoride, fluoride ions will replace the hydroxy group in hydroxyapatite, creating fluoroapatite. It's a chemical change. Well, what does that do for our patients? Really, it does two things to reduce phosphate and calcium deficits. Number one, it's going to lower the critical pH of the enamel from about 5.5 to 4.5. So when our patients are having these acid attacks or these low pH cycling events, we're going to see less demineralizing on the enamel. This is a good thing. The second thing fluoroapatite can help our patients do is it can actually help pull in more phosphate and calcium ions from our saliva. If I go back to the previous slide, we see, as we know, saliva has phosphate and calcium, and that's really what we need to get back into the enamel. And why is it that fluoroapatite can help bring in phosphate and calcium ions? It's because the fluoride ions are negatively charged and they're fairly dense. However, really important note about fluoride. Fluoride in itself does not contain phosphate and calcium. And this can be a real problem for patients with xerostomia. We work with thousands of dentists and hygienists all over the country. And the reoccurring theme we're hearing is that they're seeing a higher percentage of the patient pool that has xerostomia. Studies show that it's up to 20% of the population have some form of xerostomia. And you already know this. I'm sure you see this in your office. For example, aging population. Patients 75 and older, studies show 50% have some type of xerostomia. Prescription medications. This is a really sad statistic, but it's something we need to be aware of when we're treating our patients. But there's over 400 prescription medications in America that cause xerostomia. And we don't always get to know what our patients are on. Sometimes they might not want to disclose it on their health history form, or maybe they forget to update it. Or maybe they're going through a personal experience they don't want to share. For example, depression medication. With children, we have Adderall. Adderall causes xerostomia. We can go on to the bigger hit items like diabetes, statins. We have patients going through chemo. Then we get into obesity, mouth breathing. Children with narrow archway or airway passage. We understand that, excuse me, if we have mouth breathers, it's going to decrease saliva flow. All of these things are going to impact fluoride's ability to remineralize. And so it's really important to bring that up, because when we discuss nano-hydroxyapatite, nano-hydroxyapatite is not dependent on healthy saliva flow for delivery of phosphate and calcium back into the enamel. In fact, nano-hydroxyapatite, I've actually got some in a jar. I love showing this off. It looks like powdered sugar. Everybody wants, what is nano-hydroxyapatite? What is it? Well, it actually looks like powdered sugar. I don't think you can see it very well on my camera, but that's probably the best analogy I can give you. It's white, it's pretty, it's sparkly, all that good stuff. But if we break down the chemical composition, it's mainly calcium and phosphate. This is what our enamel needs. We need to get phosphate and calcium back into the enamel. It is a crystal. It also has oxygen and hydrogen in it. Now, for this growing population, and we didn't talk about this, why has nano-hydroxyapatite become more popular? It's because fluoride is a concern for a growing percentage of the population. And I know every one of you see this in your office. You're seeing families that have read up about fluoride and certain concerns with it. They've totally ditched fluoride, and they went online to find some type of clean ingredient toothpaste without fluoride. Well, what we can do as dental professionals is we can help educate them. We can help educate them that clinically proven remineralizing ingredients are really necessary to help fight caries. And if they really don't want fluoride, there is an alternative, and it is nano-hydroxyapatite. And they're going to ask many other questions. And one question they're going to ask, because if they have health issues with fluoride, they're going to say, well, is nano-hydroxyapatite safe? Is it safe to swallow? And the answer is yes. It's biocompatible. It's non-toxic. There's patients that will ask you, well, doesn't nanotechnology or nanoparticles, doesn't that cause cell toxicity? Is this harmful for the human body? And that's a very fair question. The European Union, which is much more stricter on ingredients in toothpaste, they spent 8 years studying nano-hydroxyapatite in toothpaste to ascertain whether or not it was safe for humans. And they published a report March of last year. We're just going to summarize their study. They said, yes, nano-hydroxyapatite is safe in toothpaste, provided the crystals are a rod-shaped crystal and that the concentration does not exceed 10%. Now, myth number 2, Dr. Jennifer, what is myth number 2?
Myth number 2, and we've heard this a lot from some brands, is that European Commission report that Peter just cited approves only one manufacturer of nano-hydroxyapatite. That's a myth. That's not true. And when you read the study, I didn't quite understand why some of these brands were citing that, because I didn't see it in the study. But to make sure that we were right in what we read, we actually went to Luxembourg and we spoke with the European Commission to ask them, is there a certain manufacturer that is better quality, higher, whatever, something that you're backing in the toothpaste, in that 10% and in the rod shaped? And they said no. No, they don't. They do not choose specific manufacturers. They were just saying the 10% rod shaped.
So the point is here, it's a Wild West. Brands can claim whatever they want. And if brands are making claims, ask them for the science or the publications. But if you read the European Commission on Safety on Nano-Hydroxyapatite, it doesn't prove any specific brands. However, they do prove rod-shaped crystals. at concentrations up to 10%. And yes, so nano-hydroxyapatite comes in all different shapes and sizes, and it is relevant for your patient's sake. Why is rod shape approved? Well, according to the European Commission, because of its shape, it has less probability of causing cell toxicity. Further in the clinical safety study, they do list needle, though, as suspect. Needle hydroxyapatite is less expensive than rod. And yes, there are brands of toothpaste that will use a needle structure. There isn't anything conclusive that we've read that a needle crystal will cause cell penetration. In fact, our body produces needle-shaped nano-hydroxyapatite crystals in our bone structure. So take it for what it's worth. But if you have patients that are concerned about nano-hydroxyapatite, I would recommend a brand using the rod-shaped crystals. Let's see, what do we have next? Okay, myth number 3. You guys are getting all the myths here. There's little history or science behind nano-hydroxyapatite's ability to remineralize tooth enamel. We present quite a bit. We just presented at a dental school, and I won't mention the manufacturer's name, but the manufacturer of a toothpaste, they brought the question up about nano-hydroxyapatite. They said, well, why aren't you using nano-hydroxyapatite? It was a big box brand. And they said, well, because there's not enough science.
There's no science.
We don't have enough history. Well, you're here to learn about nano-hydroxyapatite. There's 50 years of history. There's tens of millions of people that have been using nano-hydroxyapatite over the last 40 years. In fact, if we go back in time, one of the first forms of nano-hydroxyapatite is eggshell. You can actually buy eggshell nano-hydroxyapatite toothpaste. But what's interesting is it predates, 3 to 5,000 BC. There's studies showing that the Egyptians actually used hydroxyapatite in their toothpaste. That's kind of amazing stuff. So we're glad it's resurfacing, not just in the world, but also in the US. Now, who invented hydroxyapatite? Who gets credit for it in the US? I think this is a really interesting story. It's actually NASA. Many people ask the question, why was NASA making toothpaste? Well, if we look at the first space capsules that went into outer space, they were very confined. Number one, the astronauts didn't have a toilet. You guessed it. Or a sink. So they had to wear diapers and they had to swallow their toothpaste. In addition to that, the NASA physicians found, or the dentists and the physicians, they had a team, they found that gravity was impacting saliva flow. As we said earlier, healthy saliva flow is essential for fluoride to work. So combined with the effects of zero gravity environment and looking for an edible toothpaste, NASA created a solution or a replacement for fluoride in the early 70s. Word got out in the pharmaceutical industry that NASA had this replacement for fluoride, and it was proving to be effective. A pharmaceutical company out of Japan got wind of it, bought the patent. The pharmaceutical company's name is Sanji. They bought the patent in 1974. And I want to bring this pharmaceutical company up because we have to give them so much credit. They've made so many advancements in hydroxyapatite and nano-hydroxyapatite. And we'll talk about the difference, not just in oral care, but in medicine. But they've spent the last 4 decades, tens of millions of dollars, developing, testing, refining nano-hydroxyapatite. It took them 6 years before they released their first commercial tube to the market. So nano-hydroxyapatite, or I should back up, hydroxyapatite was introduced to commercial market in 1980 by Sanji, and they're the parent company to Apgar. It took them a total of 30 years to advance the crystal size from a hydroxy crystal or micro to a nanocrystal in 2003. And we'll talk more about this. There is a big difference between a nanocrystal and a microcrystal. But the biggest difference is that it's kind of like technology. Microcrystals or hydroxyapatite crystals, that's like 1970s technology. Where nano, it's much more advanced. It's 2003. And we'll talk about the benefits of using a nano over a microcrystal. Another interesting fun fact. We said earlier that the Food and Drug Administration does regulate fluoride, and that's a good thing because it does provide certain transparency for brands. Brands have to list the type of fluoride, concentrations, any warning labels. When we take fluoride out of the equation, brands can say whatever they want, and they are. There's a lot of misinformation out there about nano-hydroxyapatite. We're here to bust the myth. But interesting fact is that in Japan, hydroxyapatite, or Sanji's, they called it a medical hydroxyapatite, It was approved in 1993, about 20 years after they bought the patent. The Japanese government, the Ministry of Health and Welfare, similar to the Food and Drug Administration here in the US, they approved a medical hydroxyapatite as an anti-caries medicine. It's kind of sad, US, or we invented hydroxyapatite, but it was the Japanese, after buying the patent, that was able to get it to be approved as an anti-caries ingredient. I suspect as more science comes out and we see more studies that eventually you'll see nano-hydroxyapatite approved as a medicine in the US. This is part of our research team. Now, when you set out to create a toothpaste, you have to really create an amazing team. Not only did we work with some of the top chemists out of Germany, because we couldn't find a chemist in the US that had any experience, we were able to recruit some amazing people for our team on the research front. This is our son, Gabriel. He's read every clinical study on nano-hydroxyapatite. He actually has a master's in biomedical science, which he defended on nano-hydroxyapatite. He's currently a dental student at Roseman University, where he's doing research on nano-hydroxyapatite. But I want to further support the claim here that not only is there a history of 50 years of nano-hydroxyapatite, there are thousands of studies. And where do you find these studies? What's the best resource? When manufacturers or brands are making claims, ask them for hard third-party, non-funded clinical studies. One of the best resources, if you haven't been there, it's the National Library of Medicine, or PubMed. A great site to find non-funded clinical studies. If you type in nano-hydroxyapatite in the search bar at PubMed, you'll see that there's over 3,000 clinical studies. If you look at the timelines between 1970 and 2024, most of these studies were completed in the last 5 to 10 years. And so, yes, there is a lot of history. There are a lot of clinical studies behind nano-hydroxyapatite. Dr. Jen, you want to talk about other applications?
Yeah, there are so many applications to nano-hydroxyapatite that you might not even know exist. Dental implants, I think we know it helps biointegrate, but it's also used for wound care. It's used for artificial joints. And they also have started to put nano-hydroxyapatite around medicines, mainly because it helps with the delivery. So there are some meds that we actually can't digest really well, so they have to be given to us via IV. But scientists have found that if you coat the capsules with nano-hydroxyapatite, we can now orally take those medications.
So hydroxyapatite, nano-hydroxyapatite is gaining in popularity in both medical and dental applications. But for tonight, with what time we have remaining, we really want to focus on how does this work in toothpaste? How is it going to help your patients fight caries? Well, these were some other examples of, backing up a little bit. Hip replacements, coating it with hydroxyapatite. We talked about bone regeneration, dental implants, bone grafting, cancer detection, cancer research. You can get lost in all of the research on nano-hydroxyapatite. But let's talk about how are these crystals going to help your patients offset phosphate and calcium deficits? Number one, the crystals are great at adhering to proteins of bacteria like Streptococcus mutans. And so if we can have your patients brush with high concentrations, 10% nano-hydroxyapatite, what you're going to see is less biofilm. If we can reduce the biofilm or plaque, that means every time your patients consume sugars and starches, they're going to have less demineralizing. If you look at the image on the lower left hand of the slide, you can see a capsule-like structure. That is a rod-shaped nano-hydroxyapatite crystal, magnified, adhering to bacteria like Streptococcus mutans. So yes, you will notice cleaner teeth with your patients without having high abrasivity levels. Because of that, the crystal is a hexagonal, six-sided shaped crystal. It has lots of surface area. Great for removing biofilm without high abrasives. Number two, the crystals will adhere to the surfaces of the enamel, promoting surface remineralizing. Equally, what they'll do is they'll fill in the microfusures or lesions on the surfaces of the enamel. And you can see that in the imagery on the left. We have a before and an after brushing with nano-hydroxyapatite. The after will show that the crystals do fill in the surface pores, the micro lesions. And this does a number of things. It will help elevate the whitening of the tooth surfaces, but it will also create this very smooth surface, which makes it more difficult for plaque and stains to reattach to the surface of the enamel. And number three, most importantly, remineralizing. below the surface of the enamel. If you look at the slides on the lower left-hand side on the bottom, or the imagery, these are images taken before and after brushing with nano-hydroxyapatite over a 7-day pH cycling event, showing nano-hydroxyapatite's ability to remineralize incipient caries. As you guys know from dental school and hygiene program, incipient caries is one step prior to actual tooth decay. But if we look at the image or the x-ray on the lower left-hand side, just below the surface of the enamel, you can see that gray band. That's what incipient caries looks like prior to brushing with nano-hydroxyapatite. The image to the right was taken 7 days after brushing with 10% nano-hydroxyapatite. This was a study done at the University of Texas Health Science Center. But you can see that gray band has mostly dissipated. So nano-hydroxyapatite in the correct particle size, a nanocrystal, less than 100 nanometers, has the ability to penetrate surface pores, to remineralize the enamel below the surface of the enamel. And then number 4, a nano-hydroxyapatite is excellent at managing hypersensitivity. I'll just skip ahead to this slide a little bit. I'm sure you already know this. Most brands put in pain blockers to manage hypersensitivity. Pain blockers like potassium nitrate, potassium chloride. How does that work? Generally, ingredients like that get to the root of the tooth and they create a pain block from the root of the tooth or the nerve of the tooth to the brain. Nano-hydroxyapatite, instead of addressing symptoms, actually goes after the underlying problem, which is weak enamel or exposed dentin tubules. And you can see that on the imagery on the left. And this was out from an actual study published on PubMed, October of 2016. Image A shows exposed dentin prior to brushing with nano-hydroxyapatite. Image B is after. So what happens is these crystals will penetrate into the dentin tubules, occlude them, but also provide a protective coating or a shield over these areas. So if your toothpaste or your patient's toothpaste has high concentrations of nano-hydroxyapatite, 10% or higher, there's no need for pain blockers. And it's actually providing, like I said, more of a protective coating. It's going after the underlying problem instead of addressing the symptoms like potassium nitrate does. Now, we don't have a lot of time, and I don't want to bore you a whole lot, but there are some really good studies. If we narrow our search on nano-hydroxyapatite, and you put nano-hydroxyapatite toothpaste, last I checked, there's about 52 studies showing the efficacy. This is just one. I do want to support a claim that nano-hydroxyapatite is just as effective as fluoride. This is a study that was published September of 2019. I'll just touch on the highlights. What they did is they took healthy extracted teeth. This was an in vivo or in vitro study. They created an artificial lesion on these teeth. If you look at the imagery on the right, on the top row, you can see a gray band on top of each tooth structure. They measured the lesion. They divided up the teeth into 3 groups, had one group brush with 10% nano-hydroxyapatite. One set of teeth were brushed with calcium sodium phosphacylate. And then most importantly, what we're all familiar with, one group of the samples was brushed with 1,450 parts per million. This was over a 7-day pH cycling event. And what they found after 7 days was that the nano-hydroxyapatite at concentrations of 10% performed best. With this study, it just so happens that 10% nano-hydroxyapatite outperformed fluoride at 1,450 parts per million. And I bring that up because most over-the-counter toothpaste run around 1,200 parts per million. So this is a pretty impressive study. It just so happens it was one of Sanji's nano-hydroxyapatite crystals, which was, we got to give them credit. They're really the pioneers behind nano-hydroxyapatite. We can thank them for all of the advancements. Here's another study done at the University of San Antonio, Texas. I just want to let you know there's a number of studies like this. These guys got clever. They did kind of a hybrid. They created lesion on extracted teeth, cut out blocks of the lesion area, attached them to an orthodontic appliance, and then they had 2 subject groups brush for 4 weeks, one with fluoride, one with nano-hydroxyapatite. After 4 weeks, they removed the attachments, measured the remineralizing levels. With this study, remineralizing levels were pretty much identical. So there's many studies showing the efficacy of nano-hydroxyapatite. However, when you talk to the scientists, the researchers, the people in the labs doing these tests, they're going to make some points very clear to you for you to get these results. Number 1 is concentration does matter. And unfortunately, it is the Wild West. And there's brands out there claiming that concentrations don't matter. Well, that is a myth. So if we look at the hard studies showing how concentrations can impact remineralizing levels, there's sound, hard science on the on PubMed, the National Library of Medicine, showing this. This just so happens to be a study that was published June of 2009, testing 1, 5, 10, and 15% concentrations. With this particular study, what they found is there is a plateau effect. Once you get to 10% levels of concentration, 10% concentrations of nanohydroxyapatite, remineralizing levels plateau. I'll read the abstract. Within the abstract, it says there was no significant differences between 10 to 15%. However, as you can see on the bar charts on the right, there is a difference when you reduce concentrations below 10%. Dr. Jen, you want to talk about your experience working with manufacturers?
Yeah, so when we developed a toothpaste and with a chemist from Europe, and then went to many manufacturing plants in the United States that could mix up our formula and then put it in tubes for us. And every single one looked at our formulation and said, oh, 10% nano-hydroxyapatite, you don't need that. You can just sprinkle it in. And that's what we do. That's what we do. We put in 1, 2, maybe 3%. That's enough. And our response was, well, no, it's not enough. Science shows it needs to be 10% to provide the same level of protection as fluoride. And every single one of them said, nobody reads the science. And so that's really part of why we're here, because we know that we read the science, you read the science. Dentistry is evidence-based, and we want to follow the science in the products that we recommend for our patients.
And that brings up this slide here. We talked about hierarchies of evidence. It should be evidence-based. We want systematic reviews. There's brands out there, it's a Wild West. They'll say, well, according to the white pages, they're 1 or 3% is optimal. Well, ask the brands for hard studies showing that, because I'm going to reference a scoping review study. You guys know what a scoping review study. This is the pinnacle of all studies where researchers sit down and they actually read the white pages and they come up with summary points. Within this scoping review study that was published May of 2022, fairly recently, they made all of these key points that, nanohydroxyapatite can reduce demineralizing. It can help promote remineralizing. It will, I could just read through the points. It's gonna help with caries prevention. It's gonna reduce hypersensitivity. It's gonna whiten the enamel. It does all of these things, but within this scoping review study, they were very clear. It said the optimal concentration for nanohydroxyapatite toothpaste is 10%. There's no refuting this based on current studies on PubMed. So if you want your patients to have optimal caries protection or optimal remineralizing using nanohydroxyapatite, make sure the brand is following the science using 10%. This is what gets even more interesting. These are just highlights, what I'm reading on some of the brands out there. There's one brand that's saying you cannot use higher concentrations than 3%. That's not true. There's brands saying that, if you mix in micro and nanohydroxyapatite, it's just as effective. So it's, like I said, it's a Wild West. And I think there's some good takeaways here for you to help guide your patients. And so let's talk about concentration a little bit. There's brands that will use a liquid nanohydroxyapatite, as we said before. There isn't one particular manufacturer that's been approved by the European Commission. However, when you use a liquid nanohydroxyapatite, usually this bottle has 15%. And so brands will say, we use 20% of this liquid concentration. They throw all these high numbers out, and then they'll pour this into a tube, and then their final concentration is usually in the very bottom in very fine print. So when we talk about concentrations, and you're interviewing brands, we don't want to know what the initial concentration of their solution that they're putting into their toothpaste. You want to ask the brand specifically, what is the final concentration in the toothpaste? It's a simple answer. And if it's 10%, they are following the science. But it can be a little bit convoluted. Particle size. So we talked about concentration. We talked about particle shape. Particle size is essential as well. Myth number 5, microcrystals are just as effective as nanocrystals. No, that is not true. As we said earlier, microcrystal was the first crystal that was developed in the early 70s. It's a 70s technology. Nanocrystals weren't developed until 2003. I think these images here represent what you're going to get with your patients, a nano versus a micro. As we can see on the imagery on the left, that's exposed dentin tubulose or exposed dentin. You can see, number one, you get a better blanket effect with nano. It's going to be more consistent, less gaps to provide good surface protection. More importantly, We said we want these crystals less than 100 nanometers to penetrate the surface pores, but also get into the dentin tubules to provide remineralizing below the surface. Microcrystals we can see on the right, that's a this slide is very representative of microcrystal. It's early 1970s technology. You will get some surface remineralizing with microcrystals. However, because of the size, they're too large to be able to penetrate surface pores or dentin tubules. Where am I getting this information from? It's listed on a PubMed study. On the very top, there's a sentence there. Microhydroxyapatite particles are about 5 to 10 microns in size. And this is significantly larger than our enamel surface pores or the dentin tubules. Now, some brands think they're really clever and they'll mix the two. They'll say, well, we know that some of the dentists now are reading the studies and they're looking for 10%. Well, here's a great way to get to 10% by lowering the cost of your ingredients. Why don't we take 5% nano hydroxyapatite and 5% micro? Well, I think you guys get it. If you want to follow the science, we need 10% all nanocrystals to develop or to deliver the same efficacies, because that's what the studies that we represent or we pointed out we're using. Nano hydroxyapatite has also been proven to reduce root caries. And I think you get it. If we can get these nanocrystals to occlude or at least penetrate the dentin tubules, they will deliver phosphate and calcium below the surface of the exposed dentin. This was the study supporting that, published April of 2011. We got last time we did this, we had questions about MI paste. Well, MI paste uses a CCP ACP ingredient. Basically, this is a liquid version of calcium and phosphate. It's more difficult for the human body to remineralize enamel with liquid phosphate and calcium, because what happens is, or what has to happen is, phosphate and calcium has to crystallize before the enamel can accept it. And that's the biggest difference between nano hydroxyapatite and a liquid version of calcium and phosphate. Are there studies supporting that 10% nano hydroxyapatite outperforms CCP or ACP? Yes, this is just one that was published winter of 2015. Equally important, though, on the study, it said that it was concluded that nano hydroxyapatite and fluoride had the potential to remineralize initial enamel lesions, where CCP, ACP can be used as an effective adjunct to fluoride therapy, but cannot be used as an alternative. So within the study, they're saying nano hydroxyapatite can be used as an alternative to fluoride. Great study. Oh, let's see. Conclusion. Oh, whitening. This is a study testing whitening. Does nano hydroxyapatite whiten teeth? Yes, it does. This study did use 1 and 10%. And yes, you guessed it. 10% is going to give you the best results. The difference, though, when you're using nano hydroxyapatite in whitening as opposed to hydrogen peroxide or carbamide peroxide, is peroxides usually strip the enamel of phosphate and calcium. It does a great job. If you have a patient that needs this Hollywood smile, they got graduation photos or they got a wedding coming up, go for it. Give them that beautiful white smile. But what's happening when we use hydrogen peroxide or a peroxide, it's basically depleting, demineralizing the enamel. A great way to reboost the phosphate and calcium is have them brush with nano hydroxyapatite or even do a tray application. But getting back to how nano hydroxyapatite whitens teeth, the crystals are white. When they fill in the micro lesions in the surface pores, you will get some elevation of whitening. However, this particular study done on whitening August of 2022 showed that 10% gives the optimal whitening benefits for nano hydroxyapatite and toothpaste. This is our daughter. She is doing better. We get a lot of folks asking, how is she doing? She just finished her 3rd year of dental school. As I said earlier, we have an amazing team, and it's our family. We are a family. We're not an investment banker, a venture capitalist out there to try to make as much money as we can, making our toothpaste cheap. Instead, we are a family dedicated to creating the best nano hydroxyapatite or advanced preventative oral care product for our patients and your patients. This is another interesting study, and I'll just bring this up. We have 2 kids that go to 2 different dental schools, and what's interesting is what's being taught in dental schools. If you have a high caries patients, go right to the big gun. Go to fluoride at 5,000 parts per million without even doing any diagnostic work. What does this patient have? Xerostomia? Are there other underlying issues? Well, what's interesting about high prescription fluoride toothpaste, it was created 40 years ago. And as Dr. Jen said, why hasn't toothpaste evolved when everything else has evolved? Well, it has evolved. And, there are other brands out there that are using similar ingredients to evolve their formulations. But I want to bring this up because there's a study showing, or I guess a report with the American Dental Association suggesting that for fluoride to be effective, that it's important that our patients do not rinse after brushing, that they just spit and they wait 30 minutes before they eat. So I'm just curious, if you guys haven't, look at your high prescription fluoride toothpaste if you're using it in your office. What's interesting is that the Food and Drug Administration has concerns enough with high prescription fluoride for children between 6 to 16 that they put a warning label that's very specific to this point. They say for ages from 6 to 16 to basically, after spitting, to rinse mouth thoroughly after brushing. It's from what the American Dental Association is promoting, which is not to rinse, and what the Food and Drug Administration is suggesting using high prescription fluoride toothpaste. It is somewhat counterintuitive to recommend a high prescription fluoride toothpaste for a patient that has to rinse immediately. So what is the better solution? The better solution is used to advanced materials that don't require rinsing. For example, taking high concentrations of nano-hydroxyapatite and combining it with over-the-counter levels of fluoride that don't require rinsing. If we can do this, we give our patients a synergistic benefit of nano-hydroxyapatite combined with fluoride. Now, are there studies supporting you get synergy? Yes, this is a study that was published winter of 2017. With this study, they tested 7% nano-hydroxyapatite with fluoride. I believe it was 1,000 parts per million. It was a pH cycling event. I think it was over 7 days for mineralizing, but they tested the outcome between nano-hydroxyapatite combined with fluoride and fluoride alone. And not to our surprise, fluoride with nano-hydroxyapatite actually outperformed fluoride alone. And so this is a good thing. If we take advantage of the science for our patients, we can actually recommend products that don't require prescription, that don't require spitting, that'll give our patients more advanced materials to help reduce caries for those high caries patients. Well, Dr. Jen, with her engineering background, really pushed this. It took her about 3 years to come out with 3 different ingredients. But what we did was we tested this theory based on the science, where we combined 10% optimal levels of nano-hydroxyapatite with 0.22%, which is 1,000 parts per million, in high concentrations of xylitol as a replacement for high prescription fluoride toothpaste. But we had that formulation tested in a lab. The lab was Therametric Technologies. They're a very reputable lab that does a lot of testing for the Food and Drug Administration and the American Dental Association to test this theory. If we combine those 3 ingredients, can we give our patients a better outcome? And especially if we test this in the worst case environment, which is a xerostomia environment. Well, with this study, we weren't surprised at all. This was done as a pilot study that tested these two different formulations. One was toothpaste with 5,000 parts per million. The other one was toothpaste with the 3 anti-caries ingredients, and the 3 anti-caries ingredient outperformed fluoride at 5,000 parts per million.
I think the interesting thing with this is, when I was in dental school, when many of us we were told if somebody has high caries, xerostomia, throw all the fluoride you can at them, prescription fluoride, high concentrations. But I think we can throw all the fluoride we want. If the patient doesn't have saliva, they don't have the calcium and the phosphate to support the fluoride doing its job. And so the interesting thing about combining, nano-hydroxyapatite, which is calcium and phosphate, and fluoride, which uses calcium and phosphate, and just using an over-the-counter fluoride. It wasn't a high prescription fluoride for this testing, and it works really, really well. So they work synergistically together.
Let's see, just a recap for you, just finishing up, opening up for some questions. How does nano-hydroxyapatite work in toothpaste? Once again, there's really 4 functions. There's some biophysics and biochemical. Number 1, the crystals will help reduce biofilm, hence reducing the amount of acids being created during our consumption of sugars and starches. Number 2, we're going to get surface remineralizing, help elevating whitening, but also smoothing the teeth, making it more difficult for plaque to reattach. Most importantly, remineralizing, delivering phosphate and calcium ions below the surface of the enamel to remineralize incipient caries, but also to get into dent and tubulos to help reduce root caries. And then number 4, providing a protective coating over exposed dentin or weak enamel to manage hypersensitivity. Questions? Let's do it. Dr. Rolling, let's open it up.
Okay, we have a few here for you, and anybody that has questions, please type them into the chat area. I'm going all the way to the top here. Okay, what if you eat a true keto, high healthy fats and proteins diet?
Wow, and if you don't have any Streptococcus mutant and other bacteria, you probably just brush with like salt water or coconut oil. No, that's a really good point. We talked about this before, like Jennifer's grandfather didn't brush a day in his life. He never had a cavity. There's a segment of the population that eats amazing, no sugars, no carbs, and maybe they haven't been exposed to Streptococcus mutans. Those folks probably have great checkups.
Okay. Hello from Oregon. What is the pH of your products? Have you started any clinical trials of the products yet?
Okay, we did a pilot study with the super paste. Now pH levels vary a little bit depending upon the batch, because sometimes you'll get a little variance, but our pH levels are tested with each batch we run, and that runs anywhere from about a 7.2 to a 7.4. And as we said earlier, for remineralizing to occur, we got to get neutral before the enamel will accept phosphate and calcium back into the enamel.
A question from another person here. Love your products. What is the abrasivity, or how abrasive is the mint and the strawberry pastes?
Well, both of the pastes run in the neighborhood. The RDA value is in the neighborhood of 42 to 44, depending on the paste. So they're actually not that abrasive.
This is a question I think you answered a little bit later. What is the shape of the crystal that you use?
We use rod-shaped.
Can nano-hydroxyapatite implement into the DNA?
According to the European Commission report, which was an 8-year-long study, they determined that it would not alter the DNA if you read the study. So it's not us promoting that study. That would be the European Commission safety report, provided, once again, that it's a rod-shaped crystal and the concentrations do not exceed 10% in the toothpaste.
There has been a few questions about specific name brands, and I want to let folks know, because this is continuing education, we can't comment specifically on a name brand, but you can certainly reach out to the speakers this evening with a specific question by email. Okay. Going up here a little bit, there are a couple of duplicates here. What about ages? Can we use this in children 1 to 3? And there was another question about 5 years.
Absolutely. This is safe for really any age. It's safe to swallow. Nano-hydroxyapatite is actually placed in baby formula and baby food as a source of calcium and phosphate. And so using a nano-hydroxyapatite toothpaste is perfectly fine.
Could nano-hydroxyapatite be paired with erythritol for even greater positive effect?
Boy, that's a study we're going to have to include with our chemists. That's a great question. Thank you for asking that question. We're not familiar with any research on that, but it does pique some curiosity. Thank you for asking that question.
There are studies that show that erythritol in some clinical trials was more efficacious than xylitol. It's a course I present. Yeah, you might have to jump into that realm. Will it remineralize the enamel a dark color?
That's a great question. These are the crystals. They're white. It's pure white. So yeah, when we get a crystal of phosphate, and you got to remember, our enamel, 97% of it is hydroxyapatite. Nano-hydroxyapatite crystals are very small crystals of our enamel, phosphate, calcium, oxygen, hydrogen. So when you see remineralizing, you will see an elevation of whitening, especially as microlesions, surface pores are filled in.
How do you calculate the final concentration of nano-hydroxyapatite in toothpaste?
Love it. I love that question. Thank you for asking that. The reason we said that before is because there's brands out there that start out with liquid concentrations at 15%, and they'll take this and they'll say, well, we use 20% concentration of a 15%
Solution.
watered down solution, and we pour that into a tube, and we end up with at the very fine print. So how do you calculate it? It's really easy. What is the actual percentage of nano-hydroxyapatite crystals in the total formulation? And if, as we said earlier, based on current studies, if it's 10%, it does meet the requirements to deliver optimal remineralizing levels.
How long are you supposed to brush with this toothpaste? Can you use it along with fluoride rinses? And if a patient gets a fluoride, can they brush with a nano-hydroxyapatite?
Okay, so how long are you supposed to brush? 2 minutes is optimal. That's the best way to go. And you know, kind of lightly spit, but do not rinse. It's best to maintain that in there. If you really want remineralization, you want to wait about 30 minutes before you eat or drink after brushing, just because it helps the nano-hydroxyapatite crystals really engage into the surface of the enamel and the dentin.
Any side effects? I'm sorry, go ahead.
Oh, I was going to say, yeah, and as far as combining the two, you definitely could do that. There are benefits as we shared with the clinical studies. The good news is there's some brands out there, which we'll talk about here in a little bit, that make it easy for you and do combine the two.
Any side effects?
You know, with nano-hydroxyapatite, we haven't read any side effects. So the RDA is low. When you swallow nano-hydroxyapatite, Dr. Jen mentioned this a little bit, the crystals dissolve. Hydroxyapatite starts to break down at a pH level of 5.5. The typical stomach lining is anywhere from 1.5 to 3.5. So as we swallow nano-hydroxyapatite crystals, they dissolve, delivering phosphate and calcium into our bloodstream that deliver, you know, which helps strengthens bones and enamel. But as far as we're aware of, we haven't read any published studies showing any side effects with nano-hydroxyapatite in a rod-shaped crystal.
Next question. Do you need a prescription for nano-hydroxyapatite toothpaste?
No, you do not. It is just something you can get on a website.
Are you developing a varnish to replace fluoride varnish?
I'll go there a little bit. This is where you know, it's a touchy subject, because if we look at how nano-hydroxyapatite functions, if you're brushing a nano-hydroxyapatite toothpaste, we want those crystals to be able to penetrate surface pores. Varnish has a shellac in it. It's a sealer. And so you get, it's almost a little bit of counterintuitive effects if we seal it. So we've been working with our scientists for over a year on it. The other thing is if you look at varnishes, for a varnish to be effective, you're basically supercharging the tooth with a remineralizing ingredient. For example, toothpaste, normal concentration of toothpaste is 0.24%. Typical fluoride concentration is 5%. So you're upping fluoride concentrations by 20%. Using a varnish, sorry. Nano-hydroxyapatite, for it to deliver the same efficacy as fluoride, we need it at 10%. So it's a little tricky. There is one company out of Germany that we found that has been using 20%, and the studies do show that it provides the same efficacy as a 3% fluoride varnish. And so there's some challenges in doing this. And so if you are looking for a varnish, I can't remember the brand. There's a company out of Germany, but I think you're going to see one sooner or later. A brand is going to come out with one. But if they do, actually, I am familiar with one. Make sure that they have hard studies supporting the efficacy behind it, because we just don't want to recommend a varnish because it has nano-hydroxyapatite in it. We want to make sure the science behind whatever concentrations they're using are supportive enough to give these patients what they're paying for.
Okay, we've got a few more here, and they're all great questions. What about amelogenesis imperfecta?
Oh, that's a really good question. I think that nano-hydroxyapatite, I haven't read any studies on this, but I think that it would actually be pretty helpful, because it can go right through enamel pores, healthy or unhealthy enamel, right to the dentin tubules, and help seal those dentin tubules. So I actually think that would be pretty helpful.
Is hydroxyapatite infused floss proven to be effective?
Oh, I love, who asked that question? I wish I could give them a prize. Okay. Now, think about this a little bit here. If we look at floss, okay, you can coat it with nano-hydroxyapatite. If you do that, the crystals on the floss itself, if it's coated, they will help adhere to the proteins of the bacteria like Streptococcus mutant. So you will get a little bit more biofilm reduction. However, we talked about floss a little bit. Maybe I'll talk about that later. I'll save that question. So there are no clinical studies on nano-hydroxyapatite on floss. However, we do know nano-hydroxyapatite crystals love Streptococcus mutant proteins.
Okay, after brushing with the paste, do you recommend not rinsing the way we advise patients not to do so when they use some of the higher concentrations of fluoride?
Yes, we agreed. You don't rinse out.
For how long?
For
30 minutes.
30 minutes.
Okay. Is this only applied in a toothpaste? Can it be administered in office like fluoride varnish?
We have several offices that use it in trays, and so they'll paint the toothpaste because it's such a high concentration of nano-hydroxyapatite. They'll paint the tray and then put the tray on for 10-15 minutes, almost like a fluoride treatment.
And there are studies showing gels with 20% nano-hydroxyapatite delivering similar efficacy as varnishes at, I think, at 2.5%. So back to Dr. Jennifer's point, if you have patients that do not want a fluoride treatment or fluoride varnish, you can use the nano-hydroxyapatite in the toothpaste as a nano-hydroxyapatite treatment. If it's a tray application, you put it in for 3 minutes, same thing. Have them spit, don't eat anything or drink anything for 30 minutes.
Here's a question about hydroxyapatite forever particles. Would you like to make a comment about that?
I think back to the particle sizes and how they function. The European Commission did an excellent job addressing this. There was physicians on that panel, dentists. And so I would reference anybody having any concerns. Read the clinical or the safety report on nano-hydroxyapatite. These guys are much more experts on how nano-hydroxyapatite can impact or not impact the human body.
And I really think the European Commission is stronger and harder on things that go into the bodies of consumers over the FDA.
Comment and question. You've used the term clean several times in reference to ingredients. There's no scientific definition of this term. So what do you mean by this?
Basically, how we started this was when our daughter became ill, her gut biome was destroyed. And the physicians advised us, they said, look, you're going to have to make sure you look at everything and the food she eats anything, but something that would not be hard on her gut or affect her health status. And so our definition of clean, or my wife's definition of clean, is what was safe for our daughter. What can we put in the toothpaste that was safe for her to swallow when she was recovering from C. diff? And so I think the person writing this question has a really good point. Is there a technical definition of clean? I don't think there is, but our definition of it is all the ingredients we use were safe enough for our daughter to use. If she swallowed them, it wouldn't harm her in her weakened state of health.
And and we're going to head on towards the rest of your course here. The same with me. When I had C. difficile, I was told by my physicians to source out clean products. So it may not be a clinical term, but if you go to universities, some of the universities like dermatology and pharm list, quote, clean products, and they're trying to help you identify products that are transparent in their ingredients, right? So it's important that you do take a look at that, even though it's not a clinical term. It's a term being used in the mainstream quite often. Peter and Jennifer, do you want to go towards the end here and we'll bring up your promotional webinar, your product demonstration? And for those questions that we didn't get to, and there are a few, we have a way for you to reach out to both Dr. Eisenhuth and Peter right there with your questions.
Then we had, basically we had all of the clinical studies we cited are referenced on the last two slides. If you want more clinical studies, our son, like I said, he's currently published a paper. He's read over 3,000 studies. He'd be happy to direct you to more evidence to support any questions that you might have.
So with that, we are going to have both Dr. Eisenhuth and Peter Eisenhuth present Dr. Jen's natural oral care products with nano hydroxyapatite. We would love to have you stay on for a few more minutes and learn about their products. Not required for CE credit. Again, you can log out or you can stay on. Either way, you're going to get the quiz for the CE. And I'm going to go ahead and change presentations here. I'm going to change this presentation is also available in your course folder, and we're going to put the link to Dr. Jen's products at the top of the screen for you all. It'll be blue. And Peter and Jennifer, go ahead and start if you'd like.
Awesome. Hey, everybody, thank you for listening to our personal story and our journey. And we're really excited that we were able to share the science, what we've learned about nano-hydroxyapatite. As I said earlier, our goal isn't to sell toothpaste with this presentation. Our goal is to give you updated, recent science so you can guide your patients to choose a product with efficacy. On that note, if you'd like to learn more about our product or if you want to try it, we'll send you free samples. I've got a slide here at the very end. We'll show you how you can get free samples of our toothpaste. But just kind of as a recap, what we learned and what Jennifer wanted for our daughter was we were really, as parents, you want the best for your kids. We wanted two things. We wanted to make sure our daughter could use a product that was safe to swallow, non-toxic, but also something that would deliver the same efficacy as fluoride. And ultimately, I think if you ask your patients that do not want fluoride what they're looking for in a toothpaste, they're most likely going to say they want the same protection as fluoride or optimal caries protection. And so, yes, we are one of the few brands in America. There's other brands out there. I think AppGuard Royal is a great product, by the way. They're the ones that Sanji makes. They also use 10%. But we use the full final concentration of 10%, giving your patients optimal caries protection. Equally important, as we talked about, particle size. We use all nanocrystals. We're not going to cheat your patients by blending in micro with a nano. No, we want to do it right. And then we do follow the European Commission safety guidelines by using a rod-shaped crystal, and yes, 10% concentration. So if you have patients that do not want fluoride and your goals are to help them fight caries, we believe we have an amazing product. We have a fluoride-free strawberry. We have a fluoride-free cool mint. They both have 10% nano hydroxyapatite. But I will say our biggest breakthrough that's been a huge game changer is really our super paste. The super paste, I talked about this before. We talked about how it has three ingredients. It has fluoride, nano hydroxyapatite, but it also has xylitol. There are clinical studies showing that xylitol is excellent at reducing Streptococcus mutant counts. This is one study. But when you combine the three at the right concentrations, and believe me, this wasn't easy. It took us 3 years. We went through many iterations, many testing to create our super paste, but we're very proud of this product. This is a game changer. This is replacing a 40-year-old high prescription fluoride toothpaste. It is, over the last year, we've had thousands of offices sharing their stories with patients that were on high prescription fluoride toothpaste that were continuing to get high caries. But after switching to the super paste, within 6 months, reporting no or less caries, less oral tissue inflammation. We pull out sodium lauryl sulfate, just overall great results. And as we mentioned earlier, we did test this in a lab, Thermometric Technologies. It outperformed high prescription fluoride by 6 times, but this is truly a game changer for your high caries patients. The other benefits to it, we talked about, does not require prescription, safe enough to use every day. Just a great product. It's called our super paste, triple ingredient, clinically proven ingredients to help fight caries. I will talk about Floss just a little bit. I want to talk about this. There's so many dirty secrets in the oral care industry. Don't get me started. But Floss, somebody asked about a question about Floss before, but I think it's really important to know this, is that if you have patients that are on this path for looking for cleaner ingredients, well, what are cleaner ingredients? Well, things that aren't toxic for the human body. I think it's interesting to note that over 95% of floss that is used is plastic. Now, when we use floss, and I'm not going to gross you out, but when we're using floss, it's never in the same condition when we're done using it. What happens is it frays, it tatters. If we have an uneven restoration, it'll even break. But every time we floss, we deposit microparticles of that material in our mouth that we swallow. When our daughter became ill and we looked at everything, we even looked at our floss.
Yeah.
We didn't know our floss was recycled plastic bottles. It was, it's just, brands are so good at disguising what you would think would be, I guess, disguising.
I mean, we looked at, once I found out that most floss was plastic, it's like, no, we don't want plastic. So I was looking into bamboo floss that actually has a line of plastic that provides support. So it's not actually just bamboo. I was looking at coconut floss, which is plastic as well. And so it was frustrating to me to find out how much plastic is in the floss that we use. And so the only alternative that makes the most sense is actually silk. And that's the floss that we created. It's Italian silk. It is soaked in a nano hydroxyapatite solution, which is great to just grab on, to the plaque that's in between the contacts.
Yeah, and so somebody asked a question about nano hydroxyapatite and floss. And so why did we put it on floss? The main reason was to help it remove bacteria from between the surfaces of the enamel. But the biggest reason we made floss is we wanted an alternative to plastic floss. And I think the other thing is, if you're eco-conscious, when you discard plastic floss, whether it's recycled plastic or whatever plastic, it goes back into our landfills in our ocean. Are there studies talking about plastic toxicity? Yes, this is one study. So I won't get off track a little bit, but it's just another product that we make that's available for you. We would love to send you guys some samples. We've got some doctor testimonials that have been using our products for, I guess, over the last year, that they love it. But we do sell wholesale. So if you've tried our product or you're ready to commit to it, because you spent an hour with us instead of watching basketball, you're rewarded with a $100 credit towards your first wholesale purchase. These are our wholesale prices. The Superpaste retail is $25. Your cost is $15 wholesale. You get 40% off. The Cool Mint retails for $20. The wholesale cost is $12. And I just want to address the price a little bit for your patients that do not want caries. They do not want toxic ingredients, or at least they want to give their enamel a fighting chance against fluoride, or I'm sorry, a fluoride-free product, or fighting chance against caries. It costs $20 for a tube. If you break this down, a typical tube will last about 3 months. It's 20 cents a day, $6.67 a month. It's very reasonable for these families that really do want to give their enamel everything they can to fight caries. But these are the prices. If you do decide to place an order tonight or the next, week, enter in code DA100. That gets you $100 off. If you want to try a sample on your own, you just want to purchase on our main site, you can go to Dr. Jen Natural. We have a code that's off 10. That gets you $10 off any of our products on our direct-to-consumer site. You can also share that with your patients. Let's see, what else do I want to have? Claiming samples. Now, if you guys like the presentation, you really want to test this out before you recommend it or buy wholesale, go to our website, drjenoralcare.com. Fill in your practice information. Tell us, yes, I want free samples. We'll be happy to send your practice free samples so everybody can share in your practice. If you like the presentation enough where you think this would be very valuable for the rest of the team, we do provide the same presentation over lunch, where we buy you guys lunch and you get free CE. So when you go to drjenoralcare.com, not only can you get free samples, but we'd love to buy your office lunch and inform the rest of the team about the science behind nano hydroxyapatite. Let's see. Otherwise, this is our email address. If you have questions, info@drjennatural.com. This is our phone number. And then we probably have time for some more questions, Dr. Rowling.
Yes, and you have them.
Okay.
So is there an expiration date to the toothpaste?
That's a great question. I'm going to bring this up because you guys are going to love this. Jennifer we spent so much time and energy on our toothpaste. We made an eco-friendly tube. This tube only uses 1/3 the plastic. You can see when it's empty. Most tubes use really thick plastic. So our tube uses 1/3 the plastic. It does have aluminum between the two barriers of plastic. So when you squeeze the toothpaste, what happens is it doesn't expand and draw air in. So it accomplishes two things. Number one, we reduce plastic. So Dr. Jen is reducing plastic in the environment. Number two, it extends our shelf life because our ingredients are, we use many natural ingredients like essential oils. When air is drawn back into the tube, it oxidizes the ingredients, which makes them less effective and decreases the shelf life. So when we have our toothpaste made, we have a 3-year shelf life before it's opened. Once you open the tube, you have a 1-year shelf life. We're making toothpaste though, probably once every 6 months. And if your office buys a case of toothpaste and you have anything less than a year out, I'd gladly replace it. But the straight answer is it's good for 3 years from the time it's manufactured, 1 year from the tube, 1 year from the time the tube is open.
And I want to remind everyone too that at the top of the screen is a banner, and they are able to go to your website. They can tap on that link. Everyone does have a copy of your presentation in the course folder with the links as well to reach you all. All right, next question here. A lot of thank yous for the informative webinar. Great, we're happy to have you. About silk. The website says vegan. Silk is not vegan. Any comments?
Oh, they are correct. And I'm going to have to talk to my web developer. Boy, whoever answered that question or sent me that question, send me a personal email at info@drjen, and they get free floss for pointing that out. That's a typo. That is a typo. We have vegan on our toothpaste. So for whatever reason, that ended up on the website. So good, or on the floss, and it was only supposed to be on the toothpaste. Thank you for pointing that out. We will get it changed.
Do you recommend rinsing with water after using the super paste since fluoride is used?
That's a good question. We know for fluoride to be effective, same thing. It's the American Dental Association recommends not rinsing for 30 minutes after brushing with fluoride. Same thing with nano hydroxyapatite. So when we combine the two, yes, if we want our patients to get maximum mineral uptake, do not rinse for 30 minutes or eat anything for 30 minutes after brushing with the super paste.
Can the super paste be used on children?
That's a good question. The Food and Drug Administration approves fluoride at 1,000 parts per million, 0.22%, down to ages 2. Anything less than 2, it's directed by the Food and Drug Administration that it can only be used when recommended by a physician or a dentist. We generally recommend it for 6 and up. Jennifer, that's just Jennifer's. You want to go there with? No, okay. Well, Jennifer's thought is that most children swallow, if they're ages 2 to 4, they swallow about 30% of their toothpaste. It's not recommended to swallow toothpaste, and so as precaution, we really do advise our offices that we work with 6 and up. However, we are releasing a strawberry version of our super paste that is coming out for pediatric offices, and it will say in there it has directions on there talking about you can use it down to ages 2. However, under 2, it can only under the direction of use of a dentist.
Do the particles just stay in the pores, or are they actually incorporated into the mineral matrix?
Great question. What happens is they get into the pores and they provide a chemical bond delivering phosphate and calcium ions. It's a very technical question, and I could have our chemist probably explain it better than that, but that's how we understand it. It will, because it's a hexagonal rod-shaped crystal, it does actually integrate with the crystalline structure of the enamel itself.
Have you tested this for sensitive teeth?
Oh my gosh. It is amazing. We have so many offices that are dumping their sensitivity toothpaste. I just did a lunch and learn fairly recently here in Minnesota in the office, and I'm not going to mention brands, but the hygienist had major hypersensitivity. She was on a product that was using 5,000 parts per million fluoride with potassium nitrate. It was a very popular brand, and she said with that particular product, she would still get sensitivity bad enough over her lunch hour. She would have to take her lunch directly out of the refrigerator, put it in the microwave, bring it to room temperature before she could eat it. That's how bad her sensitivity was. Well, I showed up at the office 2 weeks after we sent them samples, and she was using, I got my flat tube here. She went right to our fluoride-free 10% nano hydroxyapatite. She'd been using it for 2 weeks, and she was just so excited. She's like, Peter, I got to tell you, I've been using your White's toothpaste for 2 weeks, and I have no hypersensitivity. I'm actually able to eat my lunch cold directly out of the refrigerator. This is just one of hundreds of stories. And so the clinical studies on PubMed, and I referenced one, show that nano hydroxyapatite is more effective than arginine, potassium nitrate, and other pain blocking ingredients. And so it truly is an amazing product, not only for remineralizing, but managing hypersensitivity.
What about pregnant parents? Can it transfer to the baby and cause tooth development problems?
You know, we get questions from parents that are expecting, and we always like to defer those questions to their OBGYN. As far as what we understand, it shouldn't be an issue, but we'll defer that question to your physician.
Can you see remineralization or reversing of incipient lesions on x-rays, and if so, how soon?
Yeah, love it. That one of the first slides that we showed it was after 7 days of using nano-hydroxyapatite toothpaste, and that was done at the University of Texas Health Sciences.
That was not an X-ray per se though, because I think it was a scanning electron microscope. So that was at a microscopic level. I think to see it at an X-ray level, just our typical, bite wings or PAs, it would probably take, just like it took months to create that incipient decay, it's probably going to take months to remineralize it as well.
Thank you for clarifying that. Appreciate it.
Does it have an antibacterial effect like fluoride for perio patients?
That's a really good question. What we're seeing is we're actually seeing a reduction in perio pockets with nano-hydroxyapatite, because what the crystals do, once again, they adhere to the bacteria. They actually, it's a biochemical removal versus a biophysics removal versus a chemical removal. So the crystals are excellent at reducing biofilm or bacteria in the perio pockets.
I think also, remember, we created this paste to help our daughter's gut. And so the natural essential oils that we put in there were soothing, because my thought was to kind of soothe her microbiome. And so the papaya, the black cherry, it actually soothes the oral tissues as well. And that helps with the pocketing too.
Is hydroxyapatite just something we should recommend to patients who are anti-fluoride, or do you think hydroxyapatite can completely replace fluoride for all patients?
I think if you look at, in the 1970s, the United States grabbed on to fluoride, and that's how we remineralized, and that's how we fought decay. Japan grabbed on to nano or hydroxyapatite and did the same thing with it. So honestly, I think they're interchangeable. And so absolutely, nano-hydroxyapatite is, I think, is here to stay.
Well, we're not here to dismiss fluoride. Fluoride is effective at fighting caries. I think it comes down to really, what does the patient want? If the patient doesn't have concerns with fluoride and they prefer a less expensive toothpaste, because fluoride only requires a very small percentage, around 0.24%, where nano-hydroxyapatite requires 10, it's more expensive. So ultimately, yeah, listen to your patients, have those conversations, ask them what their goals are and what they don't want. And if at the end of the day, they do not want fluoride, we can guide them towards a replacement that will be just as effective at remineralizing.
How often should it be used? 1, 2, 3 times per day? And what amount is recommended, piece-sized, etc., to be put on the brush?
Piece size is what we recommend, pretty standard. And I mean, I probably brush my teeth 4 or 5 times a day, but I think recommended, when you wake up in the morning and before you go to bed or after eating.
How far? I'm sorry.
No, I'm sorry.
How far into the tubules will the nano-hydroxyapatite travel?
Great question.
Great question.
There's a study that we referenced that shows nano-hydroxyapatite's ability to remineralize root caries. And I would say we'll have to reference that study to that. Whoever asked that question, we could share that slide or that clinical study and see if they have specific measurements on it.
Does the fluoride toothpaste with hydroxyapatite get clumpy? I popped in about halfway through. Wife was watching, sounded interesting. How does your toothpaste prevent the fluoride sticking into the hydroxyapatite before it contacts the tooth? If you went over this already, I'm sorry.
Yeah, no. That's what we're talking about now is chemistry. And this is actually kind of a trade secret, if you will, but I'll disclose it here. We know that what we're remineralizing the enamel with is hydroxyapatite, the same thing as our tooth structure is. When we introduce fluoride to hydroxyapatite, our enamel, it creates fluoroapatite. So if we can actually remineralize our enamel with nano-hydroxyapatite combined with fluoride, we're actually, in a sense, remineralizing with fluoroapatite crystals. Now, that pilot study that we referenced testing the superpaste against high prescription fluoride at 5,000, they also did an acid challenge test, where what they do is, these are great tests that they'll do. Not only you want to check remineralizing, but you want to see how well those remineralizing levels stand up to acid testing itself, because that's a real test. You can go ahead and rebuild the enamel, but if it's not going to hold up against these low pH events, what's the point? So they did an acid challenge test on our superpaste. It actually outperformed high prescription fluoride toothpaste by 10 times, the acid challenge test. So it is a benefit if you can actually combine the two. There's a lot of science, and there's a lot more to the superpaste, but that's the reason why we get reports all over the country with doctors and hygienists seeing better results with high caries patients going from high prescription to the superpaste.
Have you done any studies on fluoride reacting with the aluminum used in the tube?
Yeah, and I apologize. It gets a little confusing. Our aluminum is in a membrane, so we have aluminum, and then there's 2 sheets of plastic on it. So that the fluoride is not exposed to the aluminum. So if you pop open the tube or you cut it open, you're going to see plastic on both sides. So we have a thin layer of aluminum, and what that does is it helps create a non-memory, or a memory, if you will. So when you squeeze the tube, the aluminum keeps the tube compressed so it doesn't oxidize or pour more air in. But the toothpaste does not have contact with the aluminum itself.
Would adding arginine be effective for more neutralizing periods to help remineralization?
The clinical study that we referenced in the slide earlier also had arginine in it, and they tested them side by side. The 10% nano-hydroxyapatite outperformed arginine. So the question is how much does your patient need? Do they need arginine on top of nano-hydroxyapatite? We've had such great success with patients that have the 10% nano-hydroxyapatite is just as, or actually it's more effective than a pain blocker or another ingredient. Now, if you have a patient that 10% nano-hydroxyapatite isn't enough, yeah, I think that's something you could explore. On a side note, there's brands that use very low concentrations of nano-hydroxyapatite, and they manage their nano-hydroxyapatite toothpaste as a product that's great for hypersensitivity, yet they sneak in potassium chloride in their ingredient. So if you're having to add a pain blocker or another sensitivity ingredient on top of the nano-hydroxyapatite, we don't see, based on the studies we've read and what we've experienced personally and the testimonials we get from our patients, we don't see that you need an additional ingredient.
Any research on efficacy of lab products, synthetic versus naturally sourced?
Oh, I love that question. We are working on it. We've been brushing with a eggshell for a while, and we're testing it. We don't have anything that we can release yet, but it's a great question. Whoever asked that question, send me an email. I'm going to send you some free fly. I mean, these are great questions, but
they're really good questions.
Yeah, no, the theory is that the natural will perform better, but we are in the process of, we've been testing this for the last year.
Theory right now.
Yeah, and when Jennifer releases stuff, usually she spends about 2 years testing it in a lab before releasing anything. So stay tuned. We'll answer that question in the not too distant future.
And there were a couple of comments about xylitol and making sure you keep xylitol products away from your dogs because it can be fatal if they consume it, whether it's toothpaste or gummy bears.
Yep.
Any other questions or comments? And again, I want to remind everybody at the top of the screen there, you can tap on the banner. It will take you right to the URL. You also have the link in the course handout that's in your folder. And order your samples or set up the lunch and learns. And any other questions? It looks like we have one more that came in. How soon do you get desensitization benefit?
It actually builds. And so you'll start to see it within 2 weeks of using the paste. And the longer you go, the better the sensitivity protection.
Okay. I think we've reached the end of the internet. Any insurance codes?
We don't have anything for the nano-hydroxyapatite yet.
Okay. All right. There is no code for this course. I want to thank you both for being here this evening. This is tremendous information. I learn so much every time you present. Every time I think I've heard everything I could possibly hear, you're introducing more information, and it's great. And you've had great comments here. You all that have attended, thank you, and thank you for staying for this portion. If you found this information valuable, reach out to Dr. Jen and the banner at the top of the screen. And if you need information about CE credits, please reach out to us, not them. And we'll go ahead and adjourn here. Anything you'd like to say in closing, either one of you?
Well, guys, once again, thanks for choosing us over basketball. We're very privileged. And yeah, if you like our story, you like our brand, we are a small business. We are the David going up against venture capitalists investment. Yeah. Please spread the love, tell folks about us, and yeah, be happy to send some samples your way or to any other offices you might that might be interested in our products. Thank you for your time. Have a good night, everyone.
Thank you both. Thank you, everyone, for being here. I'll go ahead now and redirect you to the quiz.